Good day everyone, my name is Mark Garcia from 12L, and today I'm going to demonstrate about the perineal flushing. First thing you have to do is to prepare all the need material. Wash hands. While washing hands, help promote to safe and hygienic environment preparation of the item in advanced speed operation and preserve focus. Second, explain the treatment to the patient. A crucial component of the patient-centered care is describing the treatment to patient. It in the end of the contributes to better treatments outcomes and overall patient satisfaction, since it empower patient, helps them to understand their disease and therapy better, and focus or fosters trust and communication. Good day, ma'am. My name is Mark Garcia, your student nurse for today. And today you're going to have a perineal flushing. May I know your name and your date of birth, ma'am? Can I see your wristband? Thank you, ma'am. In this procedure, ma'am, I'm going to clean your private area. Is that okay with you? Thank you, ma'am. Screen the patient or locks the door of the patient room. Safety, privacy, and appropriate care are priorities that are prioritized by screening patient and securing the patient's room door. These precautions are taken to guarantee that patient get the greatest care while reducing risk and holding their rights and also maintaining their well-being. Ma'am, is it okay to you that I'm going to close the door so no one could distract you during our procedure? Okay, ma'am. Thank you. Now I'm going to position the patient on a dorsal recumbent. Put the patient on bedpan. The patient hygiene, comfort, and dignity are prioritized by using a bedpan during the perineal flushing, allowing for effectiveness and efficiency care. It aims to provide a safe and courteous healthcare experience while taking into account the patient's specific needs and circumstances. Drapes the patient, exposing only the parts to be clean. Draping the patient and only exposing the areas that require cleaning or treatment exemplifies a patient-centered approach that prioritizes efficiency, comfort, and privacy. It supports excellent patient experience and greatest result by adhering to industry best practice. Ma'am, I'm going to take off your blankie. And as I've said, you could do some diamond shape to ensure that you're going to cover the parts of the patient that you don't have to be cleaned up, and also to avoid the temperature, to avoid that they get cold. If there is a left part of the blankie here, and you could roll this to his legs so she won't get cold. Now, it's lift the shirt or the clothes to show up is private part. Now it's time for me to put bedpan under his buttocks to prepare the perineal flushing. Okay? Flush the perineal area with water. Flushing the perineal area with water is a hygiene procedure with the numerous advantages including infection prevention, wound care promotion, patient comfort, and overall well-being maintenance. Patients at risk for infection or skin breakdown, those recovering from medical operation, and people with limited mobility should all undergo this therapy. Now, I'm going to get my cotton balls, soak in the cleaning solution using my forceps. The benefits of this is employing forceps to grief cotton balls include the capacity to uphold the sanitation, give the accuracy, reduce contamination, comfort, and follow the standard. This method is crucial in healthcare settings where efficiency, safety, and consistent practice are top priority. First, allow me to wear my gloves for safety. Cleanses external and genitalia starting from the middle of the symphysis pubis down to the anus. Never retrace a stroke. Without retracing a stroke, cleaning the external genitalia from the symphysis pubis midline to the anus has the advantage of being able to avoid contamination, reduce cross-contamination, follow infection control guidelines, ensure patient control, provide a standardized and effective procedure. This strategy is intended to support the best possible cleanliness, lower the risk of infection, and protect patient dignity in medical facilities. With this second cotton balls, clean starting from the mons pubis in figure of 7 by way of external labium towards the anus. Discard. Then, the advantage of using the second cotton ball to thoroughly clean the genital area in a figure 7 pattern. From the mons pubis through the external labium and on the anus. Before discarding it, reduces the likelihood of cross-contamination and infection. Do likewise on the opposite side with the next cotton ball. By using the strategy, you can achieve thorough and symmetrical hygiene, encourage and prevention of the infectious, uphold regular procedure, and ensure the safety and comfort of the patient. With the 4 cotton balls, clean starting from mons, pubis, and figure of 7 by way of external labium toward the anus. Discard in figure of 7 by way of internal labium towards the anus. Do likewise on the opposite side with the next cotton ball. With another cotton ball, cleanse groin starting from the groin, going up tight. Use another side, the cotton ball, for near groin. Flush the perineum thoroughly with sterile water. The ability to maintain hygiene, improve wound healing, lessen infections, increase patient comfort, and comply the accepted medical practice. Using the dry cotton ball, dry the perineum with the same stroke as above. Remove the bedpan gently and turn the patient on the side. If necessary, takes 1 cotton ball and cleans one side of the buttocks. Then cleans the other side of the buttocks to dry both buttocks. It does so in order to protect patient comfort and dignity, prevent cross-contamination, assure thorough hand hygiene, and comply the accepted infection prevention standard. Turns the patient on her back and make her comfortable. Spray with the aseptic as needed.
Usab-usab.
Spray with antiseptic as needed. Ma'am, I'm gonna lift up your buttocks. Let me turn you sideways, ma'am. Mali to. Let me turn you on the other side. Thank you. Now, put the perineal pad with up and down motion as needed to guarantee patient comfort, hygienic comfort, and hygienic condition, and efficient control of physiological fluid. And then, after all, that's aftercare of the material use. Make the patient comfortable and After that, you could do the record. Ma'am, since that we're done, how did you feel? Okay, ma'am. Do you have any question or any clarification of what was on the procedure? Okay, ma'am. Thank you so very much, and thank you for your cooperation. Now it's time to record the treatment done to patient and discharge observed. Patient safety, legal and ethical requirements, quality improvement, communication, research, teaching, and generally successful healthcare practice are all factors that must be taken into account when document the therapy given to a patient and observation made throughout their care. It is essential to providing excellent patient-centered care of the unfolding industry standards in healthcare. After that, wash your hands properly, infectious control, patient safety, and keeping a clean and hygienic healthcare environment all depend on the properly washing hands after any process involving patient care, such as the perineal care. And that's all for today. Thank you for watching.